Hi, I'm Dr. Akana, and today we are going to learn about ACE inhibitors. So, I would recommend that you use the acronym NURSE MOD because this is very specific to the drug and the drug class. You will learn specific things that you really need to focus on and remember rather than trying to learn every single thing about the drug or the drug class. If you try to do that, you will not do well on your exams. It's just too much information, it's too many medications in such a short amount of time. So N stands for name of drug, but I also like to add in drug class. And it's much easier to learn your drug if you set it up this way. You can do this on your flashcard, you can do this on your notes or make charts. But basically, you have the drugs that belong to the drug class. And then you also have a separate column, designating or just basically telling you, is this a oral solution? Is this the IV? Is it supplied by tablet? So this part really depends on what type of program that you're in, if you really need to know the formulation of the medication. So medications that belong to the ACE inhibitor drug class are enalapril, benzapril, lisinopril, captopril, and ramipril. And then what you can do under this column, you can list, IV, PO, tablets, oral solution, and then you can make little notes on the side if there's one in particular that you need to remember. So for here, I've listed hospital, and I've added that enalapril is commonly used as an IV push and as an intermittent infusion. I also recommend when you're going through your notes, when you're setting up charts or you're making your flashcards, highlight the top 300 drugs. So for this drug class or for the ACE inhibitors, lisinopril is the one that's mostly prescribed. This will make it easier for you because when it's time for your exam, you can quickly go through your notes. You can pull out specific things. When you're reviewing for your boards, you're already going to have in your notes which one from the ACE inhibitor drug class is the most prescribed, and that would be lisinopril. And this is what you want to remember when you're, memorizing 200, 300, 400 drugs. You want to memorize the very specific ones that are most commonly used. U stands for understanding how the drug works or the mechanism of action. So ACE inhibitors, they inhibit the ACE enzyme, which prevents the formation of angiotensin 2. Now, if we block angiotensin 2, what happens is we are also blocking aldosterone. So if aldosterone is suppressed, then we're going to see a decrease in sodium and a decrease in water retention. And this makes sense because if we're going to lower sodium and water, we're going to lower the blood pressure. So this is why we use this medication to treat hypertension, and it is an antihypertensive. Now, the concept of the renin-angiotensin-aldosterone system can be very hard for students to learn. So I've just pulled out a few key points just to keep things basic. The RAAS system regulates blood volume, and it regulates systemic vascular resistance. So together, this will influence cardiac output and arterial pressure. There are 3 components to the RAAS system. Number 1 is renin. Number 2 is angiotensin. And number 3 is aldosterone. So to understand this concept, I have made this visual pathway for you so you can really understand what's going on and what is the point of, making a drug that targets the RAAS system. So renin is an enzyme that is produced in the kidneys, and its responsibility is to help in the conversion to angiotensin 1. Now, angiotensin 1 will become angiotensin 2 with the ACE enzyme. So the ACE inhibitor blocks the ACE enzyme, and essentially what we're going to do is block angiotensin so that we're stopping vasoconstriction. So here I have listed on the chart, ACE inhibitor inhibits the angiotensin-converting enzyme. When we block angiotensin 2, we're blocking vasoconstriction, but we're also stopping the release of aldosterone. And remember that aldosterone increases sodium and aldosterone increases water retention. R is to review what the drug is used for. So when you're learning medications, each medication can be used for multiple things. So in this video series, we are just going to focus on hypertension. And if you see FDA labeled or off-label uses, basically what that means is that the drug company, in this case, the ACE inhibitors, the drug company completed a drug trial, they completed the paperwork, and they were approved by the FDA so that we could use ACE inhibitors to treat hypertension, heart failure, and MI. Now, later on, after we've used the drug, actually in clinic and we get some experience with it, we start to see benefits for other disease states or for other indications rather than what the drug was originally approved for. And in this case, for ACE inhibitors, we actually found that it benefits diabetics. So we will go through this, in more depth in the video series entitled Diabetes Medications. So, if you want to learn more on how the ACE inhibitors are used in diabetics, check that video series out. And then also have a separate series on heart failure and on MI as well. So S stands for side effects, contraindications, and warnings. So what you want to do here is just list the most common. You don't want to list every single side effect. And for the ACE inhibitor, one of the most common side effects is persistent dry cough. Now, this dry cough does not go away with a cough syrup. It does not go away with cough drops. Patient is actually going to have to stop this medication and start another medication because there's no other way of stopping the side effect other than stopping the drug. Another side effect that this medication drug class will cause is hyperkalemia. And it'll cause dizziness as well. So keep in mind, all antihypertensives will cause dizziness. So it's not just, specifically for this drug class. You're going to see dizziness if you are adjusting patients' medication, if they are taking additional antihypertensive medicines. One interesting side effect that occurs in the ACE inhibitors, and it's very important for you to remember because it's likely to be on your exam and your board exam, is that it can cause angioedema. Now, this is a medical emergency because it can cause swelling of the lips, swelling of the throat, causing airway obstruction, and possibly death. Contraindication for the ACE inhibitors are women that are pregnant, women that are breastfeeding, and then women of childbearing years because it is very dangerous to the fetus and it's dangerous to an infant. We want to be careful because, as we just learned, the side effect is hyperkalemia. We want to be very careful and cautious, that we don't use this in patients that have, moderate kidney disease, especially if it's progressing to severe kidney disease. They're going to be at a higher risk for hyperkalemia. And then also if they already have renal artery stenosis. If your patient has a previous history of angioedema, so for an example, if you notice on their chart that they were on lisinopril 5 years ago and it was because of angioedema, and you're thinking, patient may benefit from using an ACE inhibitor, can we try it again? The answer is no. If they've had it in the past, they're more likely to have it again. So we do want to avoid this. Now, there are some cases where cardiologists will do a test dose or a specialist will do a test dose. But that is something, or that is an environment where patient is being monitored and they're looking for a reaction, but this does not happen often. So if a patient has a history of angioedema, it's a contraindication. We just don't prescribe this drug class. So warnings and precautions, very similar to contraindications. We need to be cautious because of the hyperkalemia. We need to be careful when we're combining other medications. So for an example, a diuretic such as furosemide, a lot of times patient will also be taking potassium supplement because furosemide decreases potassium. So we're trying to put the potassium back by giving them a supplement. Well, we need to be very careful if patient is also taking an ACE inhibitor because remember, ACE inhibitors can cause hyperkalemia or it can increase potassium levels. So be careful if they're on a potassium supplement, if they are taking spironolactone, that is our potassium sparing diuretic, or if they are taking aliskiren as well. All of these will increase the patient's risk of hyperkalemia. Now, any patient of any race taking an ACE inhibitor can have angioedema. However, we do see African Americans seem to have this more often than other races. So we do need to be aware of that fact. If you do prescribe an ACE inhibitor, you should definitely make sure you're counseling African American patients, that you are monitoring them closely. But you will notice that we don't use ACE inhibitors as first line or monotherapy for hypertension in African Americans. Now, it's not because of the angioedema, but actually they don't receive much drug benefit from just solely prescribing lisinopril to treat their blood pressure. So you'll probably see, if they are on an ACE inhibitor, you'll probably see the patient is on an ACE inhibitor plus a calcium channel blocker, or an ACE inhibitor plus a beta blocker. We typically do not recommend just using lisinopril just to treat hypertension in African Americans because we really don't see that blood pressure benefit. And also, we need to be aware and review their family history if they have angioedema. So if their grandma had it, their mom or their sister had it, then they're more likely to have angioedema as well. So I made this slide just so that you can get these pictures in your head. When you're thinking about an ACE inhibitor, you should be thinking about kidney function. You should be thinking about what happens when we combine other medications. What should we be careful about? And angioedema. Who is more at risk? What if they have a family history? What if they've had angioedema in the past? All of these things should be coming together. And these are probably the most important points that you're going to see on your exam as well. So monitoring and assessment. So M stands for monitoring. Of course, you want to be mindful about the potassium and, potassium medications, potassium from their diet. Also, kidney function. Monitoring their blood pressure. And then you want to assess the blood pressure at different positions as well to avoid hypotension. And you want to be careful, when you're adding another blood pressure medication, when the dose is being increased. So you want to assess that hypotensive effect that can occur. E stands for education. So the education part is pretty easy because it goes well with the side effects and the warnings. It's pretty much the key points that you should be communicating to your patients about. So eating foods high in potassium. We need to be careful if the women is of childbearing age. They should be on some sort of contraception. Let them know about the dry cough. So if they have that persistent dry cough, they need to come in and be seen because it's not going to go away from cough drops or cough syrup. The ACE inhibitor will have to be stopped. Caution when changing positions. And then you want to let them know, especially if they're just starting this or if a new medication has been added or if the dose has been increased. I suggest that you recommend that they take their first dose at home on the weekend when they have their day off. That way they can kind of see how they respond, and they're not going to be doing some activity that could put them in danger, such as driving. Maybe it's a construction worker, and you don't want them to get dizzy on the job. Very important to counsel your patient or educate your patient that the ACE inhibitors, there is a risk of angioedema. And this can occur anywhere: lips, tongues, larynx. It can cause airway obstruction. Angioedema can occur anywhere. Patients have experienced this in extremities, and unfortunately, deaths have been reported. So it's a very serious side effect. Patients need to be educated. O is for outcomes. In this case, we are talking about hypertension. So we're going to look to be sure a patient's responding by seeing a decrease in blood pressure. And we want to be sure that this decrease in blood pressure comes without excessive side effects. So for example, without them having, hypotension episodes, without them having, the persistent dry cough that's keeping them up at night, they can't sleep. Now they're in your office asking for something to help with insomnia. So you want to evaluate the blood pressure outcome and then also monitor the side effects of the medication. And for these indications, again, you want to look at the other video series. D stands for different, and I also add in different or same here because this is really important when you're comparing and contrasting drugs within the same drug class and drugs that are not within the same drug class. So for the ACE inhibitors, they're pretty much all the same when we're talking about overall as a drug class. Whereas if you look at beta blockers, we have selective beta blockers, we have non-selective beta blockers, we have mixed alpha and beta receptor blockers. So when you have that, you want to be sure that you have this part as far as different or same. And then you want to learn, what are the different key points that I need to know about a non-selective beta blocker versus a selective beta blocker. So what I did is that I made a separate video and I'm comparing all of the antihypertensives. That way, at one time, we can go over it. We can pull out the similarities of the ACE inhibitors versus the ARBs, or the ACE inhibitors versus the beta blockers. It's much more easier to learn that way because on your exam, you're going to have about 5 or 6 different choices. You're going to have a case study, and all you're going to see is different medications. So if you learn your medications, the drug class overall, you're familiar with that. Use the acronym NURSE-MOD and then go back and compare and contrast. You're going to find that your study time is really decreased and might take more time initially to set your notes up. But when you're reviewing for finals, when you're reviewing for board exams, it's much, much easier because you have it already set up and you can pull out what are the similarities and what are the differences. So subscribe if you want to learn more. Videos are uploaded weekly. I do cover all topics found in your pharmacology textbook. Also, if you have a topic suggestion or if there's something you're struggling with and you would like to see a video on it, just comment below and I'll be happy to make one for you. Thanks for watching, and I wish you the best of luck.